doing 26 through 33, and the first question is, who is eligible for the California healthcare system? And the answer to that is essentially all residents of California. And residency means, physical residence within the state and intent to reside, intent to stay. The commissioner, he can determine standards and enrollment procedures, to determine what is residency, a simplified, streamlined procedure. And there will be some form of identification so that healthcare providers can know that you're eligible when you visit the doctor or go to Kaiser or wherever. And that'll probably be a card just like many people have today, if they're lucky enough to have insurance. And one difference would be that it's universal. Everyone's going to have it. So when you go to your provider or switch providers, the receptionist is going to know what's on the card, and they're not going to spend 10 minutes asking what's the number or what's this. And every time they can never figure out my insurance card for some reason. I don't know why.
Can we ask questions now, or do we wait?
Later. Okay. Additionally, any patients going to a healthcare facility will be presumed to be eligible for the system. So this is essentially, treat first, pay later. And everyone's got a horror story maybe about this, someone they know, but like my wife was hit by an SUV about a year and a half ago, and she cracked her pelvis, and they were, asking her to dig out insurance card, talk about insurance, and she's under major medication, and who knows what pain she's feeling, and that's just ridiculous and insane. And that will be gone from now on into the system. So I guess I'd like to focus that this is radically different than today, the eligibility requirements. Today, if you are a young child from a poor family, you probably aren't getting as good a health care. There's healthy families, but they keep wanting to change the requirements for that, maybe not pay for it, or maybe make it 3 times poverty limit, 2 times poverty limit. And now everyone's covered. Additionally, if you're divorced today, you might just lose your insurance if your spouse is the employed one. If you lose your job, as many have during this recession, you lose your insurance or go on COBRA, which is a ridiculous price. So anyway, under the system, you are a Californian, you are covered. You don't need to worry about picking a job to get benefits because you are covered regardless of your job. So this brings up question 27. What if a California resident needs treatment and they're outside of California? And conversely, what if a non-California resident needs treatment in California? So first of all California residents, you're covered. You're covered as an individual. You're not covered because you're within the border. You're covered because you are Californian. So no matter where you are, you're going to be covered. The state will be billed by whoever treats you. Just as it is today, it'll maybe be more paperwork for the state. As long as you're out of state for 90 days or less, you're guaranteed coverage. So visiting family, even overseas, you're going to be covered. The commissioner will have to set up guidelines for instances where somebody's out of the state more than 90 days. I would imagine the majority of these would be something like some kind of maybe you're fished out as a consultant somewhere, or maybe construction workers on some project in some other state. But I would imagine that you'd be covered by default because your employer, if it's a California employer, they're paying in, so you'd probably be covered. And there's very few cases, I think, where you would be covered if you're out of state for a valid reason, even for more than 90 days. Let's see. Additionally, visitors in California, they're not. They would get billed just like as today. Anybody who goes to the doctor, you get billed. Your insurance company gets billed. In this case, a visitor to California, they would get billed by the California health insurance system. So in other words, whoever visits their insurance company would pay the bills, or the visitor would pay the bills. So we're not getting ripped off or anything like that, but they'll get the treatment. And the commissioner may establish reciprocal agreements and other streamlined methods in order to handle these special cases of visitors. For instance, many European countries, they have like some universal type care for everyone. So perhaps we'd set up, if you go to Sweden, you're automatically covered, and there's some kind of agreement. And then if Swedes come here, then they're automatically covered. That would be something that worked out just to streamline things, but in the future, the whole goal is to reduce overhead. Okay, question 28 is, what if you have retirement medical benefits currently? You're guaranteed maybe through some contract with your employer, and if you leave the state, and if an entitled person retires and moves to out of state, your benefits will hold. So in other words, your existing agreements will be honored, so long as the agreement is upheld. In terms of, like, if your employer continues to pay into the pot, then you're going to be covered through your existing agreement. That means kind of falls underneath the collective bargaining agreement, I believe, and things like that. So existing agreements at the time that the system goes into effect, they're going to be, covered or grandfathered in. And the commissioner may, make streamlined rules to deal with instances like this. If you retire to, down in the Sun Belt somewhere else, just to reduce administrative costs. All right. One big question that a lot of people seem to have is, what if there's a massive influx of people to California? This is a lot of people they're scared of this and what's going to happen. And this is very unlikely, okay? And if this did occur, the commissioner is empowered to set up eligibility criteria. Who knows, maybe a 60-day or 90-day, maybe 6-month residence in California before you can be covered by the system. Or maybe something else even besides that. But let's look at the reality for a second. And California is a massive, massive state. We have about 1/8 the population of America. We're as big as most European countries or larger. And it's very unlikely that a population of healthcare immigrants would seriously impact a system that's supported by 35 million Californians. So this is very unlikely. And the three costliest groups, the three costly groups that I can think about quickly would be, the elderly, for instance. And the elderly already in America, they're covered by Medicare. And Medicare covers you, regardless of your state. Maybe it probably doesn't cover you as good as the California plan would, but it covers you and it covers your prescription drugs. And you think, why would someone under Medicare, why would they want to move and, leave their family, leave their current doctor, just to save, some co-pays or save a few fees from Medicare? I would want to stay with my family personally, stay with my friends, stay with my community. Another group you might worry about is, emergency care is very costly. But if you get in an accident, you're going to be treated, most logically going to be treated at the nearest center that's capable of treating you. So, it's not likely someone's going to get shipped over into California. It just makes no sense. It's dangerous. And additionally, the chronically ill is another group with costlier care. And so this is another worry. And Medi-Cal eligible patients will not have copays, never. However, in the third year of the system, the commissioner has the ability to consider establishing copays if it's deemed necessary. So this will be based on data, looking at how the system's utilized and how things are going. But there's a commitment to keeping copays out. That's the goal. We want people, when they have problems, we want them to come in, we want them to see their professional, we want them treated. Next is long care term included. That was in my laundry list, and up to 100 days in a skilled nursing facility after hospitalization or injury is included, is provided per year. This is the same coverage currently in Medicare, but it's extended to all ages for the California plan. And of course, people with Medi-Cal, they would have additional coverage. And I believe I saw that 2/3 of people currently in long-term care are getting Medicaid, Medi-Cal. So if you need more than 100 days, and unfortunately, there's a good chance that you picked up in another way. And this concludes my questions.